You can run a 10K, have zero symptoms, and feel fantastic, all while a Widowmaker blockage is growing inside you. How is that possible? Because biology does not care how fast you can run. Your body is so good at adapting that it can mask a 90% blockage, keeping your blood flowing perfectly right up until the second it stops. This is why, for half of all men, the very first symptom of heart disease is not pain, but sudden death. In this video, I am going to show you why the healthy heart fails, how your body hides these ticking time bombs, and the only way to actually check your heart before it is too late. To understand why a healthy engine fails, we have to strip away the chest wall. When we study the anatomy of the heart, we see a muscle that demands more oxygen than almost any other tissue. To get that oxygen, it relies on a network of vessels wrapped around it, known as the coronary arteries. Early anatomists thought these vessels looked like a crown, which is where the word coronary comes from. But I want you to think of them as the root system of a massive tree. If one of those roots is severed, the branch it supports dies almost instantly. We have two main players here, the right coronary artery and the left coronary artery. The left branches into a massive vessel called the left anterior descending artery, or the LAD. In the emergency room, we have a grim nickname for this vessel, the Widowmaker. The reason is simple geometry. The LAD supplies blood to the front and bottom of the left ventricle, the heart's main pumping chamber. If you block a small twig, you lose a leaf. If you block the trunk, the whole tree falls. A blockage here stops the heart's ability to pump blood to the body, leading to massive tissue death. But how does a blockage form in someone who exercises daily? To understand this, we look at the vessel wall. A healthy artery is flexible, like a brand new rubber garden hose. The inner lining is called the tunica intima. In a perfect world, this lining is smooth like Teflon, and blood cells slide past it without friction. But life is not perfect. Over decades, factors like high blood pressure, high blood sugar, and smoking act like sandpaper on this coating. Even the mechanical stress of high-volume blood flow during decades of intense exercise can cause microscopic scratches and tears. This is where the trouble begins. Your body tries to repair these scratches. It sends LDL cholesterol to the site like spackle to patch a hole. Then the immune system sends white blood cells to inspect the repair. These cells consume the cholesterol, turn into foam cells, and eventually harden. This hardened mixture of cholesterol, calcium, and cellular waste is what we call plaque. This condition is known as atherosclerosis. Here is the misconception that gets people killed. Most people imagine plaque buildup like a clog in a bathroom sink. They think the pipe gets narrower and narrower, until one day the water just stops. They assume they will feel it happening with chest pain or shortness of breath. That is logically sound, but biologically incorrect. The human body is incredibly adaptive. As plaque grows, the artery wall stretches outward to accommodate it, preserving the opening for blood flow. This is called positive remodeling. You can have massive plaque while the artery remains fully open. Blood flow stays normal, and there are zero symptoms. This is why the first symptom of heart disease for 50% of men and 64% of women is sudden death. They feel fine until the very second they do not. So what flips the switch? What turns silent plaque into a fatal event? It comes down to stability. Imagine the plaque like a blister covered by a thin layer of skin. This is soft plaque filled with inflammatory material. During a sudden spike in blood pressure or extreme exertion, that thin covering can tear. This is a plaque rupture. When the plaque ruptures, its contents spill into the bloodstream. The body panics and sends platelets to clot the blood. This is helpful for a cut on your finger, but disastrous inside your heart. Within minutes, the clot grows large enough to completely seal the artery. It is not the slow buildup that kills. It is the sudden clot, acting like a cork in a wine bottle. Blood flow stops instantly. This is a type 1 myocardial infarction. There is another scenario, common in endurance athletes, called a type 2 myocardial infarction. Consider a 50-year-old runner named Robert. Robert has normal cholesterol. During a race, he does not feel crushing chest pain. He feels weak, lightheaded, and nauseous. He assumes he is dehydrated. At the hospital, doctors find troponin in his blood. Troponin is like the liquid in a glow stick. When heart muscle cells die, they break open and release troponin into the bloodstream. Robert is having a heart attack, but his arteries are not fully blocked. He has a 50% blockage. The issue is supply and demand. At rest, the flow is enough. During intense exercise, the heart demands more blood than the narrowed artery can deliver. The muscle begins to suffocate. This is ischemia. Robert also has atrial fibrillation. The heart's electrical rhythm becomes chaotic. Combined with a partial blockage and a rapid heart rate, this creates a perfect storm. The heart beats too fast to fill properly, and oxygen delivery fails. Generally, chest pain appears when an artery is about 70% blocked. Below that, the heart compensates. Above that, pain appears with exertion and disappears with rest. This is called stable angina. Most heart attacks occur in arteries with less than 50% blockage because soft plaques rupture more easily than stable ones. Your heart does have a backup system called collateral circulation. Over time, it builds small detour vessels. This is why older people may survive heart attacks that kill younger individuals. Exercise helps build this network. In medicine, we say time is muscle. After 20 minutes, damage begins. After 90 minutes, heart muscle turns into scar tissue, which does not pump. Men often experience classic chest pain. Women may feel fatigue, shortness of breath, or severe indigestion. A sudden sense of doom should never be ignored. When arteries fail, cardiologists perform a PCI. A catheter is inserted. The blockage is opened with a balloon, and a stent is placed to keep the artery open. To find problems early, blood tests are not enough. They show what is in your blood, not what is stuck to your arteries. A C scan detects calcium buildup. A score of 0 is ideal. A score over 400 is dangerous. A CT angiogram detects soft plaque before it hardens. This is the best early warning system we have. The healthy heart attack is often a tragedy of ignorance. Control blood pressure, manage blood sugar, stay active. Do not guess your health. Use the technology available and know